Hi, everyone. Welcome to Snap Cuts School Meals Consequences, Protecting Community Eligibility and Children's Access to School Meals, hosted by the Food Research and Action Center. I'm Steve Hayward, FRAC's Communications Manager. Before we begin, I'd like to cover a few brief housekeeping items. We expect this webinar to run about 60 minutes. We are recording the presentation and will send the recording and slides in a follow-up email. Closed captioning is available. To turn captions on, click Show CC in the bottom taskbar and select English as the spoken language. When the presentation is over, we'll have time for questions and answers. To ask a question at any time, please use the Q&A tab, also in the bottom taskbar. With that, I'll pass it off to Erin Heisum, Senior Child Nutrition Policy Analyst at FRAC. Take it away, Erin.
Everyone to FRAC's Thursday webinar, Snap Cuts, School Meals Consequences. Before we get started, I just want to wish everyone a happy National School Lunch Week and take a moment to recognize the tremendous work, thought, and care that goes into making healthy meals for nearly 30 million children every single school day. Next slide, please. For those of you who may be unfamiliar with FRAC, we are a leading national anti-hunger organization here in the United States. We work to end poverty-related hunger by increasing individuals' access to the federal nutrition assistance programs. And we do this through three main ways: research, training and technical assistance, and advocacy. Next slide, please. Today's webinar covers such an important and sometimes misunderstood topic: the interconnectedness between the Supplemental Nutrition Assistance Program, otherwise known as SNAP, and school meals. Federal nutrition assistance programs are inextricably linked, and for good reasons. Connecting SNAP participation to school meal participation ensures children have access to the nutritious food that they need to thrive both at home and in the classroom. It also reduces redundancies and inefficiencies in government programs. Today, we're going to focus specifically on the Community Eligibility Provision, or CEP, and how SNAP cuts in the recently passed budget reconciliation law, known as HR 1, may impact schools' abilities to implement CEP. I'll provide a brief overview of CEP, quickly explaining how the provision works, benefits to the program, and highlighting participation data, but I'm really only going to touch on the highlights and the program basics, because we want to spend the majority of today's webinar speaking with our panel of experts and getting their insight on how the SNAP cuts may affect their operations. If you need more background information on CEP, visit FRAC's website. You can look at our YouTube channel to see previous recordings about the provision, or just reach out in general, and we'll be happy to answer your questions. We will include links to our resources in today's follow-up email. And as Steve mentioned, if you have any questions throughout the presentation, please use the Q&A function on the bottom taskbar of your screen, and we will get to them during the panel discussion. Next slide, please. So at its core, CEP, or community eligibility, allows high-need, high-poverty schools to offer all students free school meals, regardless of their household income. It is a key step towards healthy school meals for all and ensuring that all children, regardless of household circumstance, have access to the nutrition that they need to succeed in the classroom and beyond. Next slide, please. Here's a brief little timeline history of the provision. CEP was created in the Healthy Hunger-Free Kids Act of 2010, phased in gradually state by state over the next few years until it became available nationwide in 2014-2015. In the fall of 2023, USDA released a final rule lowering the participation threshold from the previous level of 40% to the current level of 25%, which I will get into in a few minutes. This new lower threshold went into effect last year, the beginning of last school year, and it significantly increased the number of schools that were eligible to adopt CEP. Next slide, please. All right, getting a little more into the details on how it works. Schools, individual schools within a single district grouped together, or entire school districts may participate in CEP if they meet certain eligibility requirements. I'll explain, don't worry. CEP schools don't collect school meal applications. Rather, eligibility is determined by a certain subset of poverty called the identified student percentage. Participating schools must offer both breakfast and lunch at no charge to all students. So this is different than some of the other provisions within the National School Lunch Program. And each CEP cycle lasts up to 4 years. So once a school commits to CEP, they can stay in the program for 4 years, regardless of changes in poverty. At the end of that 4-year cycle, schools reevaluate their identified student percentage. Eligible schools can begin a new cycle, while ineligible schools may qualify for a grace year. Next slide, please. So talking about eligibility a little bit, schools, groups of schools within a single district or the entire school district are eligible to participate if their identified student percentage, something you'll hear me refer to as an ISP, is at least 25%. So let's talk about what that means. Next slide. All right, we're going to sit with this slide for a minute because this is really important to understand, both in understanding community eligibility, but in also understanding the implications that SNAP cuts have on school meals and CEP. The identified student percentage, or the ISP, is the key factor in determining CEP eligibility and federal reimbursement. The ISP, or identified students, are a subset. It's just a subset or a fraction of the children who would qualify for free and reduced price meals if the school collected school meal applications. And this is really important to remember. The ISP is lower than what a school's free and reduced price rate would be if the district collected applications. Identified students are those children who are automatically eligible for free school meals without an application because they are part of a specific category or because their household already participates in specific federal means-tested programs. So children who are identified as homeless, from migratory families, are runaways, are in foster care, or in Head Start are automatically eligible for free school meals without an application, and they are counted towards a school's identified student percentage. Likewise, children who participate in SNAP, TANF, FDPIR, and in most states, Medicaid, can be directly certified for free school meals without an application and are also counted towards the school's identified student percentage. It's important to note that SNAP is the largest program through which children are directly certified for free school meals. Let's touch on Medicaid for just a second. Currently, 44 states use Medicaid and household income data to directly certify children for free or reduced price school meals. It is only those children who are directly certified for free school meals through Medicaid that count towards a school's ISP. Children who qualify for reduced price school meals through Medicaid don't count towards a school's ISP. As you can see on the screen here, the ISP calculation itself is pretty straightforward math. You just take the total number of identified students, you divide it by the total number of enrolled students, you multiply by 100, you get your percentage. If that percentage is equal to or greater than 25%, the school is eligible for CEP. Next slide, please. Here's just a quick visual to remind you which children are directly certified for free school meals without an application and count towards a school's identified student percentage. Again, it is those children who receive SNAP, TANF, FDPIR, and in most states, Medicaid, as well as children who are experiencing homelessness, who are from migratory families, are runaways, are in foster care, or participate in Head Start. Next slide. Few main points to remember, because I know that was a lot, and federal nutrition programs are like acronym soup, so you might already be confused about ISP and CEP and FDPIR and all of the things, but here's the keys. 1, identified students are a subset. They are a fraction of the total number of children who would be eligible for free school meals if the school collected meal benefit applications. 2, ISP is the basis for determining CEP eligibility. If the school has an identified student percentage of 25% or greater, you're eligible to participate in CEP. ISP is also the basis for federal reimbursement. And without getting too in the weeds here, a multiplier is applied to a school's ISP to determine the percent of meals served that are reimbursed at the higher federal free rate, with the remaining meals served reimbursed at the lower federal paid rate. So essentially, the higher the school's ISP, the more federal reimbursement the school receives to implement CEP. The lower the ISP, the less federal reimbursement CEP schools receive. And that's why we see the highest adoption rates in schools that have the highest ISPs. It makes more financial sense. Schools are able to cover the cost of offering all students free school meals. Next slide, please. If you've heard me talk, you've heard me say this before, there are numerous benefits to community eligibility, both for the student and for the family, as well as the school nutrition operator and the school itself. And our panelists will speak to some of this in a little bit. But to start us off, school meals not only combat childhood hunger, but CEP also supports household food security. Research shows that when a child attends a CEP school, families have more money in their household budgets to make ends meet. Families spend less on groceries overall, and one study even showed that families were able to purchase higher quality foods for their own dinner tables. So families are spending less on groceries and they are buying better, higher quality foods. We know that school meals are the healthiest meals that children receive in a given day, and children who eat school meals have better diet quality. They eat more fruits, more vegetables, more whole grains. They're exposed to a wider variety of fruits and vegetables. The lunch tray really is a living textbook. So children get to experience and learn what constitutes a healthy meal just by going through that lunch line. So as we reduce the stigma by offering free school meals to all children, instead of categorizing kids by their household income, we increase participation in the school meal program, and we bring those benefits of school meals to even more students. Next slide, please. As I mentioned, CEP benefits the school nutrition operator and the operation itself. By eliminating the need for school meal applications, CEP reduces administrative burdens, increases operational efficiencies. It allows for innovative service models. It gives school nutrition professionals time to focus on their mission, which is feeding children nutritious and delicious meals. And importantly, CEP eliminates school meal debt. There's no more counting, collecting money, chasing children down for unpaid school meal fees. This financial burden and this increase in school meal debt has been a problem since the end of the pandemic. Next slide, please. We've seen tremendous growth in CEP adoption since it first became available nationwide over a decade ago. Last school year, over 54,000 schools implemented community eligibility, bringing the benefits of free school meals to more than 27 million children nationwide. We saw tremendous growth or adoption rates in states that have supportive school meals policies, such as the 8 states that had healthy school meals for all policies last year, and the 3 states, New York, Washington, and Oregon, that had state policies supporting CEP adoption. And we will hear from some of those states in a few minutes when we get to our panel discussion. Next slide. Community eligibility also serves as a foundation for states' healthy school meals for all policies. There is tremendous momentum behind healthy school meals for all. Last school year, approximately 60% of schools that operated the National School Lunch Program were offering all students free school meals, either through CEP or supportive state policies. This school year, there are 9 states nationwide, indicated here in green, that have state policies that offer all students free school meals. Congratulations to New York for becoming the 9th state nationwide. And you can see on this screen, the momentum behind this movement continues to grow. Our states in yellow and blue are also working towards healthy school meals for all. And our panelists are going to talk about the intersection between CEP and their state policies here in a minute. Next slide. So that is a deep dive into CEP's history, regulations, participation, but we're really here today to talk about the current policy landscape and how cuts to SNAP hurt school meals. So remember this visual, I just said it. I remember I said SNAP provides a direct link between free school meals and it also impacts the school's ability to implement CEP. Well, the opposite is also true. Cuts to SNAP that reduce the number of children receiving SNAP benefits breaks that direct link to free school meals and impacts the school's ability to operate CEP. As children's participation in SNAP decreases, a school's ISP decreases, and the amount of federal reimbursement, the amount of federal dollars that schools receive to operate the programs also decrease. Next slide. Back in July, I'm sure as many of you know, Congress passed the Budget Reconciliation Law, also known as H.R. 1, making devastating and unprecedented changes to SNAP. The cuts are going to have a negative ripple effect throughout child nutrition programs. But one of the biggest changes to the SNAP program is this administrative and benefit cost shift. Essentially, states are going to start paying more money to implement SNAP. The share of administrative costs that states will have to pay increases. And for the first time in the program's history, states are going to be required to cover a portion of SNAP benefits. The amount that they will have to pay to cover benefits is determined by their payment error rate, which includes both over and under payments. Keep in mind that error rates are often caused by inadequate staffing, outdated technology, and changing regulations, and they're not related to fraud. As states face increasing costs to administer SNAP, they may attempt to control those costs by restricting SNAP eligibility. So, for example, states could end a SNAP practice called broad-based categorical eligibility, which essentially helps people get enrolled into SNAP. These cost control efforts could result in fewer children receiving SNAP benefits, which in turn will sever that child's direct link to free school meals and that ripple effect throughout child nutrition programs. Furthermore, and our panelists will touch on this, state budgets are already tight. As SNAP costs increase, states are going to face difficult decisions on whether or not they can afford programs like Healthy School Meals for All or even summer EBT. And we have already heard governors state their concerns regarding future SNAP costs and how they're impacting decisions to implement other child nutrition programs. Next slide. H.R. 1 also prohibits specific groups of legal immigrants from obtaining SNAP benefits, specifically refugees and asylum seekers. Refugees and asylees are no longer eligible to receive SNAP, thus breaking their direct link to free school meals and that negative cascade throughout the school meals and other child nutrition programs. This may be especially problematic for schools that serve large populations of refugees and asylum seekers. Next slide, please. There are a number of other harmful provisions in H.R. 1 that will have a dire consequence on an individual's access to food and nutrition education. For example, H.R. 1 ended SNAP-Ed, a proven and necessary nutrition education program working in schools across the country. SNAP educators have a long history of partnering with school nutrition professionals to turn the cafeteria into the classroom, conducting nutrition education, even doing SNAP outreach in schools. There are utility deduction limits and internet cost exclusions that will affect families' monthly SNAP benefits, as well as harmful work requirements and time limits that place undue stress on parents and guardians and will ultimately reduce families' food resources and increase hunger in homes. There's really a lot to discuss about the SNAP cuts themselves, and I encourage everyone to check out FRAC's blogs, FRAC Chat, our YouTube channel, and our SNAP website to learn more about the far-reaching effects H.R. 1 has on communities across the country. But now I want to make sure we have time for our amazing panelists. Next slide. So we have a group of dedicated child nutrition professionals that are here with us today. First, I want to introduce Todd Krumbacher, the Director of School Nutrition Services at Bullitt County Public Schools in Kentucky. We also have Caitlin Lazarski, the Director of School Nutrition at Pine Bush Central Schools in New York. Sharing the advocate perspective, we have Anna Corson, the Deputy Director of Full Plates, Full Potential in Maine. And finally, we have David Wheeland, the Policy Advocate from Partners for a Hunger-Free Oregon. So let's get started. Next slide, please, Steve. All right, I'm going to kick it off with our food service directors and ask them to talk a little bit about the community eligibility provision, what it looks like in their district, and what it's meant for their students and their community. So Caitlin, can we start with you?
Sure. So I'm the food service director for Pine Bush Central School District. We are a relatively small rural school district, about 60-ish miles north of New York City. And I have 7 school buildings. All of them are community eligible thanks to the extension of the CEP eligibility when the threshold came down to 25%. So our ISP currently sits at 37%. We are shy of the 40% that had originally been the target prior to the expansion 2 years ago. So as soon as New York State also came up with some legislation to expand access to free meals for all students. So the legislation was written that if you qualified for the community eligibility provision, the state would subsidize that to make sure that you were getting the full benefit of every child receiving free meal reimbursement. So I think we'll get into this a little bit, but the way that we look at our ISP and how it's financially feasible in a school district is our ISP is multiplied by 1.6, and that's the number of meals that we get provided at the free rate, which right now is like just shy of $4.50 a lunch meal, and $3, it's a little over $3 for a breakfast meal. So it's not very much. And then the remaining balance would be paid at the free rate, which is about 40 something cents. So it's very difficult for school districts to maintain a positive financial status if they don't have a high enough ISP. So New York State coming in and providing that additional funding for schools and extending access to free meals in New York State was very helpful in getting more and more kids fed. So in 2023, Pine Bush came onto the program with a relatively low ISP of 37.14%. And right at the time, prior to, we were collecting applications, and our participation in breakfast was about 23%, and lunch participation was about 54%, and meal debt was huge. So we had, I think, in that first 2 months of school, about $20,000 in outstanding debt from kids who weren't paying or couldn't pay for their lunches. And as soon as we went over to free meals for all, our participation in both programs started to grow. And right now we sit at a breakfast participation of about 40% district-wide and 65% district-wide for lunch.
Thanks, Kaylin. I think you alluded to this, but really the power of that policy. Congratulations to New York becoming the 9th state for healthy school meals for all, and really taking that stepwise approach for passing CEP legislation first. And I saw this at a national level as we look at the data, and I think you mentioned it too, is that state policy providing that subsidy really kind of was the driving factor that allowed CEP to become more available to more schools across New York, particularly at those lower ISP levels, correct?
Yes, absolutely. I mean, it wasn't, prior to being in Pine Bush, I was in a larger, more urban school district where the ISP was much higher, closer to 60%. So we were receiving the majority of our meals at that free rate, and we could utilize the CEP program with just federal funds. It's very difficult with a lower ISP to do that without the state subsidizing.
We need to invest in CEP at a national level, right? Todd, turning to you, can you tell us what CEP looks like for your district, being in Kentucky, not having any kind of state policy, not having CEP subsidy or healthy school meals for all? What is community eligibility meant for your schools?
Sure, absolutely. So we serve approximately 13,000 students across 23 schools. As our participants can see there, 13 of our schools are part of the Community Eligibility Provision. When you look at Bullitt County, we're located just south of Louisville, about 20 minutes south of the main city here in Kentucky. We kind of divide our county up into 3 regions, and we've got one region of the county that is more socioeconomically in a better place in terms of household income. And so we have 6 of our 10 non-CEP schools are located in that region of the county. And, looking at ISPs and looking at those percentage rates, to us financially, it hasn't made sense for us to pull the trigger yet on those schools being CEP just because of the financial implications of it. When you look across the state of Kentucky, and I think we're going to talk about this here in a few minutes, but Bullitt County is one of maybe 11 or 12 school districts in the state of Kentucky that are not yet full CEP. And one of the reasons is just the long-term sustainability of it. But I can tell you CEP has been a blessing for our families who do have students in those schools that are part of the provision. If you look at our paid lunch meal price, it's $3 for a paid student. For breakfast, it's $1.75. We try to keep the cost as reasonable as we can because we do want all of our kids to participate in our meal services. But if you look at the lunch at $3 a day, you multiply that by 5 days, that's $15 a week that families are spending to participate in our school lunch program. And then breakfast, $1.75, multiply that 5 days a week, that's $8.75. So you guys do the math on that. If a kid eats with us and they're the full paid price, it's $23.75 a week per child that our families are paying for those students that are paid status. Unfortunately, we don't reach as many of those children as we would like to, but for those families that are part of the community eligibility provision, it's a huge cost savings. And even those families that could financially afford to pay for school lunch, when we talk to our local politicians here in Kentucky, we often, talk to them about it. It feels like a tax break. My wife and I were a prime example. We got 2 kids that attend a CEP school. We would never qualify for free meals, our families, but it truly feels almost like a tax break when we can send our kids to school knowing they're going to get a healthy breakfast and a healthy lunch provided to them at no cost.
I think you bring up 2 things that stood out to me. One is partial district implementation, right? So oftentimes we hear this hesitation from school districts saying, if we can't do community eligibility in all schools, then we're not going to do them in any schools. And I think you really are shining an example that, like, yes, you can, and you bring the benefit of CEP to as many children as possible because it helps the entire community. And the other thing I thought about as you were talking too is, I believe Feeding America has a statistic that looks at food insecurity and eligibility for federal nutrition assistance programs, right? And so the eligibility is here and the cost of living is here. And there's an entire gap of populations of people who don't qualify for free or reduced price school meals because we tell them you make too much money, but they're still struggling every single day to make ends meet. And this population is really serviced by CEP, right? Because like you said, it's a benefit back into that household for them. And I wanna follow up with you, Todd, for a minute, because Kentucky, as we talked about, you don't have supportive state legislation, yet you have one of the highest CEP adoption rates in the country, even without state legislation. Can you speak for a minute to what you think contributes to this strong uptake? And how so many Kentucky schools have embraced CEP? What was driving that?
I just my feelings surrounding it. When we came out of COVID, I mean, there for 2 years that we were universal free meals, and there were several school districts in the state of Kentucky that were not yet full CEP districts. And during that 2021-22 school year, we're providing universal free meals to families. And there were so many districts, so many directors that I network with. They say, how do we pull back away from that? How after 2 years of providing free universal meals, how do we say no to our families? That's no longer a thing. And so there were several districts in Kentucky that decided coming out of COVID. I think it was that 22-23 school year where we kind of got back to normal operations. There were many districts in Kentucky that decided to go full CEP at that point. I don't know how many of those directors were really looking at long-term implementation. That CEP formula, the reimbursement, the 1.6 multiplier, that's a complicated formula for someone that doesn't really go in there and do the math on it. And so I don't know how much, because people in our industry, they have big hearts and they want to feed kids. And it just made sense to them that, hey, we've been feeding kids for free for the past 2 years. We're going to keep doing this. That's where a lot of the school districts pulled the trigger on that. And like I said, there's only 11 or 12 school districts here in the state of Kentucky that are still partial CEP like us here in Bullock County. But one of the reasons we have not gone full CEP yet, Aaron, is just because of the multiplier. They bring the ISP threshold down to 25%. And to be quite frank with you, that really doesn't mean a whole lot unless you change the 1.6 multiplier. Now, if they were to increase that, then I think it makes more sense to take some of our schools with a lower ISP over to CEP. But as much as we don't like to talk about it, there is a business side of this work, and we have to remain at least somewhat profitable to pay our employees and to pay our food costs and our repair costs. And I think sometimes our heart for feeding kids kind of takes us away from that business mindset.
Yeah, I agree. And I think that's why when you talk about the multiplier, they need to invest in the program. The reason we're here today too is to talk about these SNAP cuts and how those cuts to SNAP may affect your ISP, which is going to put further strain on your ability to even implement CEP at the current multiplier. And not to, peel the curtain back too much on you, Todd, but I do have the privilege of sitting in some Kentucky meetings Todd leads with school nutrition professionals, and something I really love about Kentucky is the collaboration that you guys have and how you share information and you work with advocates and you work with partners, and all the school nutrition directors come together and say, hey, I've got this survey, here's how I calculated CEP, here's my Excel spreadsheet. And I know that's not unique to Kentucky. New York does it. School nutrition professionals are a close-knit community, but I just have the privilege of getting to watch you guys in action sometimes. So thank you for that. Turning it over to our advocates to kind of get the advocate perspective. Let's start with Anna up in Maine. Anna, Maine was one of the very first states to pass healthy school meals for all. Can you walk us through what your state policy looks like? Because each state has slightly different policies, and then how it intersects with CEP. Like, why do we care about community eligibility when Maine is already offering free school meals to all students?
Yeah, thanks, Erin, and hi, everybody. So Maine has actually done things a little backwards. We had a healthy school meals for all policy before we really focused on CEP in our state, and I'll share more about that. But as far as our healthy school meals for all policy, it uses a combination of federal and state funding to provide school breakfast and lunch at no cost to all students that attend a public school that participates in the National School Lunch Program. And this has been said a few times, but I do think it's important to reemphasize, and Maine is actually a bit of a cautionary tale. CEP is a critical component of a sustainable school meals for all policy because it supports schools to gather an accurate count of the need in their district without relying on school meal applications. And it also helps schools and the state to maximize federal funding. So because of this, many, if not all, of the other states with healthy school meals for all policy, they do include a CEP mandate, like we heard New York does. And while the first draft of Maine's bill that we helped to write did include a CEP mandate, it was actually stripped from the final version. And as a result, not all eligible schools were participating in CEP, and that's kind of stayed true over the last few years that we've had this policy in place. And this made it very difficult for Maine to maximize federal funding and also for schools to get an accurate count of the percentage of students that are eligible for free and reduced meals in their districts. We have seen a big increase in school meal participation statewide. We're kind of a small state in population, but really big geographically. We have around 170,000 students that are enrolled in public schools, and over 70,000 of them eat breakfast every day, and over 116,000 eat school lunch every day. So the combination of the huge jump in school meal participation, the unintended consequence of universal meals eliminating the incentive for families to fill out school lunch applications, and a lack of a CEP mandate has meant that Maine state contribution to fund healthy school meals for all has actually increased year over year. So during last year's legislative session, with CEP and SNAP under threat at the federal level, and seeing another increase in Maine's contribution to healthy school meals for all in the state budget, we decided that it was time to amend Maine's policy to finally include that CEP mandate that we had tried for early on. So the mandate, it basically requires that all eligible schools participate in CEP as a condition of receiving state funds to feed all students at no cost. So this was happening at the same time that Maine started participating in USDA's Medicaid direct certification pilot that Erin mentioned earlier. This was also around the same time that USDA expanded CEP eligibility. So both of these changes boosted the number of schools eligible to participate in CEP. So we saw a jump from 96 eligible schools in 2023 to 320 in 2024. And 114 of those eligible schools were participating in CEP last year. And our CEP mandate just became law just before this school year, so that won't actually impact the number of eligible schools that are required to participate in CEP until next school year. So we do expect a big jump for next school year. And then it's also important to note that Maine actually delayed the implementation of the CEP expansion. So last school year, we were still operating under the 40% ISP eligibility threshold. So that change with the expansion will be reflected in the number of schools eligible for CEP this school year. And we're actually still waiting on data from the state.
Yeah, I am excited to see what your numbers are, because I think booms are going to come in CEP for the next 2 years. One with passing Medicaid direct certification, which we know is a game changer for CEP adoption. When states start implementing Medicaid direct certification, it increases schools' ISPs and it increases that federal reimbursement. So more schools are able to financially cover the cost, to Todd's point, of implementing CEP. And I think one of your really key main messaging here is CEP, community eligibility, and that federal reimbursement is still the foundation of school meal programs, right? And so if schools start to lose federal reimbursement, if their federal reimbursement starts to go down, it's going to shift that cost onto states at a time when they're already facing increased costs to administer SNAP, right? So in the next few fiscal years, they're going to have those provisions roll out that I just mentioned on the previous slides. So their state cost to implement SNAP is going to go up. And then if schools are receiving less federal reimbursement, the state cost to implement healthy school meals for all is going to go up. And at some point, the state budget is just going to be stretched so thin. So thanks for bringing that up, Anna. I appreciate it. Let's go across the country now over to Oregon. David, can you share a little bit about Oregon's legislation? Because I know you've been leading the charge here on healthy school meals for all, and you are so close, but you don't have it yet. So can you tell the audience what you guys do have in Oregon?
Yeah, of course. Thanks for having me. We're not there yet, but we're in a great place, and we're definitely not giving up, even with all of the challenges ahead of us. I'll tell you a quick story of how we got here. In 2019, the Oregon legislature was really focused on how do we overhaul education funding and outcomes in the state. And as part of that conversation, we brought this wild idea that hungry kids can't learn, that no child should go hungry during the school day, and really put that into the conversation around educational outcomes. It wasn't achievable at the time, but that discussion of dedicated funding for education gave us some room to work with and come to a sort of a policy compromise at the time, which still exists in Oregon. So really, it has two things actually. So one is that CEP incentive that we heard earlier, that districts and schools, the lower ISP, it just doesn't financially make sense to participate. If you want to serve a good meal, you have to pay for it. But in our policy, the state will add to that federal reimbursement to make sure that meals that weren't reimbursed at that federal free rate would receive at least 90% of that federal free rate. So we're not getting to 100 in every case, but we're significantly incentivizing it, especially for the lower ISP schools in Oregon. We also at the same time knew that this wouldn't apply to every school, and we expanded the free and reduced meal program in Oregon to say for schools that couldn't implement CEP, they could serve free lunches, breakfast to families at or below 300% of the federal poverty level. So we took that free and reduced lunch program and we expanded it to higher income. Of course, we passed this in 2019 and we didn't really get to see the impact until the end of the pandemic declarations. I think in 2019 we had roughly like 1 in 5 schools in Oregon participating in CEP already. In 2022 we were at about a little over half of schools. In 2020, start of 2023, it jumped another 20%. Start of 2024, we're at 94% of public schools in Oregon participating in CEP. And that jump between 2023 and 2024 was really important because we already had nearly every school that was eligible for CEP participating. We had 2 things line up. We've talked about this expanding the CEP eligibility rate, so more schools were eligible. At the same time, Oregon opted into the Medicaid Direct Cert program, which increased ISPs from 5 to 10%, I think, on average in Oregon. And it both brought in more schools to eligibility, and it increased federal reimbursements to schools that were already participating. This really like powerful incentive to stretch those state dollars to make them go further. So that's where we're at. I think I talked to our state department last week, and I think we actually have 22 schools in Oregon that are not yet serving free school meals for all out of the 1,200 or so schools in the state. So we're actually optimistic about the ability to make it to 100%, even as these financial forces are coming down.
Yeah, you've done so much work, David, to get there, and you are so close. So kudos to you and your team and your partners for almost getting to that finish line. We see it. But let's transition now to everybody and really talk about that intersection, right? The intersection between that SNAP cuts and community eligibility that we've been discussing this whole call. So from both the district level and from the state advocacy level, what is keeping you up at night? What challenges or concerns are you anticipating about these cuts? How do you foresee these changes affecting, schools' ability to implement CEP, and then both your advocacy efforts at the state level and your programs? So let's start with our food service directors again. Todd, what effects might these SNAP cuts have on your operation and the schools that you have doing CEP right now?
Sure. As you know, it's already been mentioned, it's going to have a direct impact on those students that directly qualify for free meals through the direct certification process. We would think that a lot of those families would qualify, maybe based on household income. But then you got to go through the process of connecting with those families, getting them to fill out the application. And so, that creates a little, some burden, in terms of administering the program. But it's going to impact our ISP percentages for sure, because those direct cert numbers are going to be impacted. We in Bullitt County, we feel like we have been very strategic about adopting CEP with our schools that we know there's a great need at. We aren't anticipating any major impacts here in Bullitt County from those numbers, but I will tell you, with some of our districts here in Kentucky, there's going to be some serious conversations probably around, is CEP sustainable for this particular school community? And so that's going to be extremely challenging for districts if they've got to reach out to these families and say, hey, this school community is no longer part of the provision. School meals are no longer going to be universally free in this particular building. Those are going to be some difficult conversations that could potentially be had to have. But I definitely see some impacts with the ISP scores. Most districts are, they determine their labor hours in their kitchen based on meal participation rates. And so if you're not feeding as many kids, you may not need as many people in the kitchen working. And so there could be some impacts in terms of staffing and labor hours. And so definitely some challenges on the horizon, I believe.
I feel so dense that I didn't even make that connection through the line, because I think about obviously the impact it's going to have on the child, right? Losing access to school meals, the stigma it's going to bring back if you're a CEP school and then you go back to that traditional model, the stigma that's going to return to the cafeteria. I think about the burden it's going to put on families, because those those applications, if you haven't seen those applications, there's a lot of pieces that they're asking for on those applications. They are not straightforward. They are confusing applications to answer and to complete. I think about the burden, the paperwork burden it's gonna put on you and Caitlin and your teams to pulling you out of schools and processing all that paperwork, and the meal debt, right? Like, families have now gone years in some of these schools without having to pay. To the point we brought up earlier, you know, a lot of families are living just above eligibility, right? They're living just above qualifying for a free or reduced price meal, and they're still struggling to make ends meet, and your meal debt's going to go up, and how that impacts other areas. But to think about now to add on that labor hours, you're right? As participation increased with CEP, you hired more staff or gave staff more hours, right? And gave them a better quality of life and living in their own homes by paying them more. And to now take that away or to have to fire staff is going to have ramifications throughout the whole system. That's, yeah, alarming. Caitlin, do you want to kind of talk about it from another operational perspective?
I mean, what's keeping me up at night? This conversation is going to keep me up all night tonight. Thank you.
You're welcome. That's what I'm here for. Positive energy.
I mean, there's yes, all of the things, you know, we are in New York, as far as the state association, the New York School Nutrition Association, we know that this is a budget ask. And so we will continue to advocate every year. It's not a given. Like, we know we have healthy school meals for all this year. And so every year we're looking at it as, we need to continue to advocate. We need to continue just, you know, to have legislators visit our schools, see how many kids are participating in the program, see the quality of what we're providing to kids. And the reason that we're able to do that is because of the increased funding that the state has decided to subsidize. So, you know, we're helping more local farmers. We're making more connections with local agriculture, because we're able to take that time away from being the debt collectors on the phone and calling up the local farms, or, you know, introducing new equipment, getting some training in for our staff so that we're doing higher quality, better, more scratch cooking, more nutritious meals for our kids. And they're responding, right? They're coming to lunch. We're having a higher participation rate. It's all good things, right? And we're getting the funding so that we're able to continuously reinvest into the program for, like you said, staffing, food quality, equipment, training, all of the things that we need to make the program what it really should be, and that we've kind of been underfunded for years and years and years. So yeah, it's very stressful to think about what this is going to look like. New York is one of the states that has a high-ish, it's up there. It's one of the higher error rates for SNAP. So this HR1 cost sharing thing is very much going to affect New York and their ability to have funding in the state. They have to make some decisions. They'll have to make some decisions about what they're going to fund. And, you know, it's possible that this isn't going to be something that will continue. And, you know, New York's every state's very diverse, but we have New York City, and then we have what we call the Big Five: Buffalo, Syracuse, Albany, Rochester, and Yonkers. And those are 5 major cities. All of those schools are high level ISPs. So they were pre-pandemic qualified for CEP. So with us, you're looking at a lot of the small rural districts, or the districts that sit outside of those big cities, that are just over that threshold of CEP or making it work financially. So the majority of students are housed in those big cities, and they'll be okay. So we have to still advocate for the other, like 750,000 students that could fall off or have fallen off prior to this expansion. So we just continue to advocate, continue to ask people to come in, legislators to come in, see the benefit of what we're doing and what that money is going to. But yes, I'm staying up at night now thinking about it.
Well, we're all in this together, and all 400 plus people who register on this webinar. So we are all working on this together. And I know you, like I mentioned in Kentucky, have a really strong partnership with Hunger Solutions New York, and your advocates and your school nutrition directors up in New York too. And you brought up a few things that we haven't touched on yet. One is that farm to school piece, right? And you know, I don't know if a lot of people realize that school meals are such an outlet for American agriculture, right? We have the Buy American provision, schools are embracing farm to school initiative, but we need to make it financially viable for farmers too. And so when we increase participation, you're allowing economies of scale where you as a school nutrition department are able to purchase local products at a rate that is going to be beneficial for the farmer too as well. And so all of that interconnectedness with the community and the local ag community is at jeopardy as well, right? If we start to lose federal reimbursement and decrease participation. And something I really appreciated about your governor and your push to move from CEP subsidy to healthy school meals for all was her message around affordability. And to Todd's point, talking about this being a tax benefit, this is like a kickback to families, right, who don't even qualify for free reduced price meals. But this is about affordability. And I think New York really kind of hammered that message home to get across the finish line. So Anna, let's go to you in Maine. You know, what are you worried about? And I'm just gonna say a quick reminder, if the audience has any questions, drop it in the Q&A chat in the bottom toolbar, and we will get to them probably right after this.
Yeah, similarly, staying up at night, we're definitely really concerned about the impact SNAP cuts and Medicaid cuts too will have on Maine's Healthy School Meals for All policy and also on Maine kids and families. You know, it's been said, but SNAP will make our Healthy School Meals for All policy more, these cuts to SNAP, sorry, we'll just make Healthy School Meals for All even more important. Because when kids are losing access to food outside of school, we have to make sure that they're being fed in school. And we do expect food insecurity for children to skyrocket across our state. We already have the highest rate of childhood food insecurity in New England. So just worried about the impact it's going to have on individual kids. And the seismic cost shift of SNAP funding, estimated to be around $60 million onto our state, will significantly strain the state's budget and could threaten funding for Healthy School Meals for All, as the state is going to be forced to make impossible decisions about competing anti-hunger policies and priorities. And we're at a point where our School Meals for All policy has been around long enough that there are Maine students that are in their final year of elementary school, so fifth graders, who have never experienced the stigma associated with getting a free lunch. And that's because school meals have just become an accepted and valued part of the school day by students and parents and educators and administrators. And if we're no longer able to invest in feeding kids at school, that's going to cause some serious upheaval in Maine schools. And Todd kind of hit upon it. That's going to be a real challenge to communicate out to families why they can't just get a free meal anymore, and they now have to fill out paperwork. So, that would just have a huge impact on the schools. And it'll mean that kids will again be hungry while they're trying to learn. We have seen, just as Caitlin was talking about, an increased focus in school kitchens on student engagement, local food sourcing, and culinary skills development. And we're really kind of seeing this transformation of the school food system in Maine. And there's just some exciting and innovative things happening in school kitchens. And if this policy goes away and school nutrition professionals have to return to spending their time to, collecting paperwork and chasing lunch money, all of this great progress that we're seeing will come to a halt. It's been said, School Meals for All policies help to reduce food insecurity for children, and they also support taking a little pressure off of the household food budget. And then there's the impact on other really important child nutrition programs like summer meals and summer EBT that are just, critical in a rural state like ours.
Yeah, thank you, Anna. We didn't dive too deep into all of the SNAP cut provisions, and there's ones that are going to directly affect direct certification ISPs, like the ones I talked about immigrants, lawfully present immigrants, refugees, and asylum seekers no longer having SNAP, right? That's a direct cut. But then there's some of those other ones that I talked about with regard to utility deductions and the time limits that the parent may lose or the guardian may lose their SNAP benefit, but the child could retain their SNAP benefit. So the child could still be directly certified for free school meals. But what you brought up, which reminds me, is it's going to make that role of school meals and after school meals and summer meals even more vital, because household food resources are decreasing, household hunger is increasing, and the role of these child nutrition programs in ensuring that at least that child has access to a breakfast and a lunch and a supper and a summer meal is become even more important. David, I know we're at the 5-minute mark now, but you want to share a little bit about what you're thinking in Oregon?
Yeah, I mean, we're in a similar place. You know, Oregon is facing multi-billion-dollar deficits over the coming years, and yet we are still going to be making the case that this is one of the most important programs to protect an investment that the state can make. When we can't backfill every SNAP cut, we can at least assure this security for children in our state. This is one of the most popular policy priorities for voters in our state, for the citizens of our state. We've done polling that shows, I think 84% of Oregonians support over $100 million in state funding going to this program. It's across party lines. In a time when grocery costs are rising, and we can make the case that this makes a significant impact for nearly every family in our state. And yeah.
Thank you for that. And to end on a positive, I think we have a lot of work ahead of us to really explain this connection, right? To tell our policymakers and our communities, cuts to SNAP are cuts to school meals. Cuts to SNAP hurt school meals. And no one wants a child to go hungry during the school day. We really need to repeal the SNAP cuts and invest in school nutrition programs. And FRAC has a link where you can contact your member of Congress and you can urge them to repeal the SNAP cuts and to restore SNAP to the way that it should be so that families have access to the nutrition that they need. And we will send that link out in the follow-up email for everybody. I know there was one question that came through the chat I saw just asking generally about community eligibility and is it only for public schools? And the answer to that is no. There are private schools. There are charter schools that are in CEP. The key is that you have to be on the National School Lunch Program. So if the school is on the National School Lunch Program, for the most part, and you meet those eligibility requirements, of course, it's a federal program and there's nuances. But yeah, we do have public and private schools participating. I want to thank my panelists today. You are all so busy, and happy National School Lunch Week. I appreciate you taking the time out of your day. Steve, we have a minute. If you want to pull the slides up, I'll review some FRAC resources. Look at that beautiful slide. Okay, let's skip ahead. We do have a community eligibility website that has all of the research I talked about, a variety of fact sheets available for you. Take a look. Next slide, please. Our CEP database. So this is an online interactive database where you can look up which schools and which districts in your state are eligible for CEP and are participating in the program. It's based on last year's data, 24-25, but it's a really great tool to see who's eligible at what ISP level and who is participating. Next slide, please. We will send out the slides, a recording of this presentation in the follow-up email. So everyone who registered will get access to this. It will be posted on our YouTube channel. So please share it widely. Stay in touch with FRAC. Reach out if you have any questions. Sign up for our listserv so you know how to get involved. And please continue to promote the benefits of school lunch. These are one of the best public health programs and investments that we have in this country. And we all know children cannot learn on an empty stomach. So thank you to all my panelists for doing what you do day in and day out to make sure that we have a well-nourished future. Thanks, everyone. Have a great day.